Hi, this is Martin Wucher again. I'm sure you're getting to the end of your nerves. I promise you it'll be the last coronavirus issue on Namibia. Um, but I'm hoping to put you another step forward. While most of us have been celebrating independence and dignitaries have been inaugurating our new president, the old and the new president, I've been sitting having a great time compiling another video, and it'll go upstream or up onto the internet at 10 o'clock tonight. So here we go. Let's have fun. Thank you for taking the time and listening. Um, the practical summary, this is the fourth part. I was initially only planning to do 3, but once again there were many questions, and of course then there is the issue of what government can do and might be doing and possibly is not doing at this time. So I'm talking rather fast. There's lots of information. If you want to check out something that's on the screen, just pause, have a look, and then just carry on from there. Once again, this is not medical treatment. This is just for information and prevention. Cool. This is what we call the birthday edition. Namibia has been independent for 30 years, and I believe we've got lots of reason to celebrate, to be grateful, to be humble, and also to realize that we are in a special place in today's world. Isn't it amazing? I opened up my calendar today and I pulled off yesterday's little page, and look at what pops up. I'm constantly discovering new ways to improve my health. This is fascinating. Namibia's got the big 5. Yes, we've got the big 5. That's what the tourists normally look at, the ones that are not coming at this stage, but they will be coming again one day. So let's see what the big 5 are. Number 1, the elephant in the room, is we have got peace. This is not taken for granted. There are many countries where this isn't the case. So guys, let's be chuffed. Let's be really grateful for that. We have got a massive amount of goodwill. If a nation has got a very diverse culture, and we have got very diverse backgrounds and skill levels, but we have got goodwill, then we are fine. We are absolutely fine. We've got amazing people still in this country. So let's look at that as well. We've got a wonderful people, many traditions, many skills, and then of course many quirks as well. We've got space, 2.5 million people in a huge space where we have basically 2 people per square kilometer. That's 2 people for every 10 hectares. That is just amazing. And yet we're screaming for space all the time. At the end, if we look at our animals, we look at our nature, we look at our sunsets, we look at our streams, we've got one of the harshest countries, and yet we've got one of the most beautiful countries in the world. Thank you, Namibia, and happy birthday to the nation. Right, that's it for the independence celebration. Let's get going. Let's get back to the issues at hand. We're still sitting with corona. We haven't got any of our own infections yet, but our neighbor South Africa is hitting the exponential growth curve, which means they've got more and more people every day, and it's really scary. So what would be a good way to prevent getting into this exponential growth and infection curve? Let's have a couple of ideas. Let's look at what we can do. Now, if we want good answers, we need to ask the right questions. The bottom line, and I've said it before in the other videos, what do we need to do to prevent people dying? That's all we really need to answer. There are many choices. We can ramp up issues, we can isolate people, we can ramp up our medical facilities where we don't have the money for it. We also have to make sure that whatever we implement is absolutely sensible. The fallout from this situation is the big financial fallout. I don't think we realize yet what Namibia has to battle with just because we don't have tourists. I think some of you have seen the Facebook pages, the information that goes around, what it does, what isolation does to tourism. It's just a disaster. But anyway, we'll come out of it one day and we'll be better and stronger, hopefully. So if you hear some raindrops, it's good news. I'm sitting here with my office doors open and the raindrops are starting to hit our corrugated iron roof, which is great news, which is fantastic for this country. We just love it. Good. If you want to help a nation, make sure people don't end up in hospital. Because if they end up in hospital, it's going to cost a fortune. The average stay in the ICU for a corona patient, if he gets to that, is about 30 days. And if you take 30 days and you multiply it by, say, 3 or 4 or 5,000 days, let's just take a simple one. Let's take 4,000 a day times 30. So we're sitting at 120,000 Namibia dollars. You can do a lot for that. Good. So in other words, to sum it up, stay out of hospitals. Whatever we do, we need to make sure people don't end up in hospital. That doesn't mean they don't get sick. They may get sick, they may have a snotty nose, they may have a fever. But yet, if we can do something that prevents them getting into hospital, this will be amazing. So let's see. Kom ons maak 'n plan. Here's a sample. Here's a Buddha plan, a suggestion. So first of all, whatever we do, it has to have low risks. So we're not going to do something that can make things worse. It has to be cost effective, and if it works now, we might as well use it in future. Say next year there's a flu epidemic or something else, and viruses will come back. So if it works now and it's effective, we might use it again. Let's try and do something that doesn't interfere with our daily lives. Okay, we have got isolation already and so on. This leads to all sorts of other problems. But let's try and keep that as minimal as we can. The fear that goes with this is not good for your immune system. As I've said before, if your body is under threat, if it's fearful, your immune system gets switched off. If a lion chases you, you don't need digestion, you don't need an immune system, you need flippin' legs to run. So this is what the body does. Fear, hysteria, and anxiety leads to a depressed immune system. So go and relax. This must be practical. It must be easy for people to understand, and of course it must provide a roadmap to where we want to end up. Yes, I've talked about money already. We must try and limit the impact of COVID because it really affects all of us. Now let's see where we are at this stage. I've drawn up this map just to help us see where we are and try and get a roadmap from this. Now we've basically addressed already, and in the media the government has been saying things like washing your hands, disinfecting, cleaning your house, and so on. And then of course we've been inundated with tips and tricks to clean up, like hand sanitizers. We are isolating our country by closing the border. We're isolating groups by closing the schools. We're isolating the people from each other by sending them home and staying home. Okay, so that stuff is in place. What I'm trying to go into now is, let's see if we can have specific procedures and mechanisms that help us prevent getting sick. So the first thing that I will talk about is immune boosters. They are targeted supplements and antivirus. These I've addressed in my second video quite a lot already, but this is on a national level, so please bear with me. This is what I'm going to try and show you here. And then of course there are rescue interventions. If a person is really sick, like we have had some of our tourists that came here that actually were infected on their way here, they are now in certain specific hospitals. They're in the ICU and they get extra care. There is the big thing of intravenous vitamin C. There are certain other drugs that have been found in the last couple of weeks to be quite effective. So long story short, there are interventions that will help you to a huge extent, virtually making sure that you come out of this alive. But as I've said before, number 4, the rescue interventions are the extremely expensive ones, so we don't want to go that route. Cool. So any government program has to be effective, it should be fast and implementable. Costs, yes, there is no money, we're bankrupt as it is, so let's see if we can scrape together a little bit. And we don't want any risk, so we're not experimenting on people, we're using stuff that has been used before. And then of course we have to be able to do it here in Namibia. And time is of the issue. Let's try and do this 10-14 days. Yes, of course, and as so often, this is not a place to score big time money. This is not a place to get rich quick. This is not a place for corruption and abuse. So what we're trying to do is do something that will help the nation prepare it and limit detrimental impacts. Where are we now? How far have we got? Let's see. 21st of March, Independence Day this year, 2020. We have got to the 2 top ones. We've done them already. So now we are looking at the 2 bottom ones. And this is where government, private citizens and healthcare systems can all get involved. It's called the Triple P, private-public partnerships. Very lovable words been thrown around often in Namibia, but in this case it really has some substance which can do that. Citizens wash their hands and stay at home. Government provides certain issues that we will talk about, and the healthcare systems are ready to handle what's coming our way. So if you're a bit lost, please try and go back to this video. I've done it. It was set up to give you lots of information for what you can do at home to be safe, to prepare yourself and your loved ones for any virus infection. And remember, it's not just for corona, it's for every virus that comes along every year. Mainly flu viruses, coronas are about 15% of what we see every year, so it's not a new thing. It's just that this coronavirus is very, very infectious, and it's got abilities more than the others to infect every cell in our body virtually. So here we are. This is what we did. I'm going to give you a graphic presentation of where we are in our tower. We've been taught to wash hands, sanitize, and home care, so our hygiene is optimized. We've closed the country borders to certain tourisms, people from areas that have had the virus, and we want to limit infectious risk by doing that. Number 3, we have sent people home, so hopefully they stay at home, and we will make sure that they are fine there and don't infect other people there. Okay, so the individual isolation has been in place, as we know, but the big issue that I will address or try and address here is that nobody in very few public institutions and even public media have focused on the immune system. Now, I think if we go back in history, there's some lessons that we can learn, and I went and I tried to find some pictures of old cities, old civilizations, and this one popped up, Machu Picchu, which used to be the capital city or one of the capital cities of the Inca Empire. And if you look at this, these are the ruins. So in other words, a civilization, one of the most advanced civilizations of its time, was nailed and was destroyed for 2 reasons. The enemy got access, and number 2, the enemy was trusted when it arrived. Those go hand in hand, and I'm not going to talk about the trust as much, but I want to show you that all these cities had very different levels of protection around them. If you look at the ancient European cities, they were all built, they had high walls on the outside, they had specific entrances, and right on top in the middle at the highest point, which was least accessible, was the castle with the with the king and the people that were the leaders of the time. So they had the highest level of protection, and until you got there, you had to actually fight through a whole lot of walls. This holds for countries, it holds for cities, it holds for your house. You've got a fence, you've got a wall, you've got several walls inside, you've got alarm system, and so on. And guess what? It also works for your body. So what I've done is I've given you a graphic here which shows the cell in the middle. And remember, the virus that wants to harm you has to get into the cell. So first of all, it has to get onto your hands, and as you see there, the green bar locks at access and it can't get into you, so it's been stopped right there. The second one is the isolation that Namibia has implemented. It's very effective. It was one of the key issues in China, and it's also one of the key issues, I believe, in this country. So there's nothing wrong, and I believe it's one of the tools that will help us go to a better future. The third one is staying at home. That's isolation once up, and as you see on this graph, you can't get any further. The cell is fine, but there is one problem here, and that is that we also need to look at the immune system. This is the system that protects us day and night, that sorts all the access violations out without us even knowing about it. It works while we are either conscious or unconscious. And as I've put up here, we're sitting on the stoop with our beer, looking forward and looking at the nice sunset. Meanwhile, somebody is trying to get into our backyard and coming from the back trying to harm us. And as you've seen, number 4 is our immune defense, and COVID-19 is highly infectious, and it's got many mechanisms to go from one cell to the other, much more than its predecessors. What is also interesting in all the studies that came out in the last couple of months from the places China, Italy, and wherever, you could say virtually all the people that died in the end had a weakened immune system. They had other diseases that knocked them down, and then the virus came on top of that. It's called comorbidities, and that really was the final straw. Once again, if you look at the cell in the middle, we really need to boost our protection mechanism, and this is really the essence of this lecture, that we should focus on simple ways to go and enhance our immunity. And I believe it's going to have a huge impact on the final outcome. Why do I say that? At the moment, we hear that we're talking about vaccinations and all that. Yes, it's a cool thing, but let's not forget, if we look at this graph on the left here, and you see I've got this little red dot here. This is a T cell, and it's got an antigen. Now, an antigen is a little part of some pathogen of a horrible guy, either a virus, a fungus, or bacteria, that the body has cut off or taken, and these dendritic cells present it to the native T cells. And the T cell gets activated, it makes many more of it, and then it differentiates, and ultimately out of that come a whole lot of different immune cells. There's a B cell, and that B cell makes antibodies. There's a killer cell, a natural killer cell, that will specifically attach to that antigen. And then there's also a phagocyte, which is a cell that eats up other cells. So these are all activated, and they are now ready when this antigen, in other words, if that specific virus or whatever comes along, our immune system is ready for it. It's now a known criminal, and the immune system will react very, very quickly. Ladies and gentlemen, this natural vaccination occurs 24/7, 365 days a year. So this is what's happening anyway. So my question is, why are we vaccinating? We are vaccinating to actually make this even more efficient. But remember, by the time this virus gets around next year, it will look very different. So the body is the fastest. It's much, much, much faster than any company, any laboratory in the world in producing the right reaction to this virus, full stop. So all we need to do is optimize our own little internal vaccine factory. Cool. Take Corona. Corona has got antigens. You see these little green spikes on the surface. That is an antigen that will be used here, and it goes through the same process. And once the body's done with it, the body will have a certain amount of immunity against that virus. And even if the virus changes, it won't change that much that the body won't recognize it at all. It might take a while to go look at the new mask, but eventually it'll recognize it. So there will be a cross reactivity, a cross function. There will always be some sort of a little bit of immunity once the virus has been in your body. Cool. So if we need help to implement stuff in a country, to learn new things, to find out about procedures, drugs, or anything that have worked in other countries, we need to ask experienced people with the right knowledge and with the right integrity. Why do I say that? Because if you listen to the wrong guy, he may take you for a ride. Now that's just common sense. And I want to add here that big problems often get solved with really simple solutions. And the people in the history of humankind that made the greatest strides, and you can take them all. You can take Leonardo da Vinci, you can take Galileo Galilei. They all said the earth is not the middle of the universe, and they were burned for it or banned for it and whatever. And guess what? A couple of 100 years later, they were the ones that got the recognition. Cool. So it's not the mainstream people. Let's look at some people that I believe are really valuable for us in Namibia today. Here is one, Dr. Vasquez. I've talked about him in the previous videos, and I just want to go into a little bit more detail about what he can help us with. First of all, he's got 3 doctorates. This guy is highly educated. He's spent his lifetime in this environment, in natural nutrition, and what can be done and what can't be done. And these are pages that I really suggest you pause the video and look at what he's been doing in the last couple of decades. He's a very well recognized person, respected, and also his integrity is without doubt. Now, Alex wrote a book, Antiviral Strategies and Immune Nutrition. I've had that book for about 4 or 5 years. I've used it extensively, and it's one of the most amazing summaries of research that I know. And that book is part of Inflammational Mastery, which is an even bigger book, but that's just on the sideline. So this book was out, it was available, and then 2 days ago, now make it 3 days ago, I got an email because I'm on his mailing list, and he wrote this: the digital publication of this production in memory of antiviral nutrition. Now that sounds really funny. What was that? What it was is this book has been available on Amazon. Now, you would think in a time like this, where the whole world is in panic stage because of a virus, that any books that provide you solutions with solutions and options to actually get rid of that virus would be like gold. So why would somebody like Amazon basically go and delete this book off their book list? So ultimately, when we look at this here, Amazon as publisher and distributor banned the book in March 2000 without any explanation, reason, or course of remedy. Now this is really weird. So this is my first feeling. What's happening there? There must be much more to this virus than just meets the eye. There must be stuff there that certain people don't want you to know. And if I have that, then let's just see why they would ban a book written by Dr. Vasquez. So first of all, Dr. Vasquez in that book has gone, and he didn't say that, he just took research from other places and he put it in his book, and you can see the articles at the top. These are articles where mention is made that people were harmed after being vaccinated. This is the one, you can read it for yourself. There's another one here. It says, and this is Vasquez's story, you can basically read the whole lot in due time, and I would really suggest you do that. And then of course he says, even if you use vaccinations, you need proper nutrition, because vaccination, as I've shown you just now, has to rely on your body function to actually make good antibodies. If your body doesn't function, whether it's natural vaccination or whether it's done by something that gets stuck into your body, the basic mechanism is still the same. So you need to have an immune system that works. If your immune system doesn't work properly, you've got a good chance of getting sick from that. Look at this one at the bottom. Children have a high risk of hospitalization after flu vaccines. Now, these are articles that were in that book, and I can imagine that this is something that somebody didn't like. Cool. Let's look at another person, Dr. Andrew Saul. We will talk about him later. He actually put up this link because his research and his comments and his YouTube videos were censored. They were taken off, they were blocked, you can hardly find them, it's quite a battle. And you might note it at the bottom, the link is not YouTube, it's Brighton.com, so that's an alternative video source that he's now moved his videos to. So obviously somebody is trying to prevent this information coming out, and this is really weird. So if you don't know why something's happening, look at the intention, look at the basic bottom line. Why are people doing what they're doing? And often one of the really simple ways, and we can see it in this country, is just follow the money. Now that's old stuff, and I think that's what I'm going to say here. It's for you to decide and for you to do more research and to take this further. But let's get back to practical advice. So, if something is threatening somebody's business, it must be good enough to actually threaten him. So it must be working. So for me, it's all the more reason to look at what these guys are saying. So let's do that. If we start using supplements, the first question is, where is your proof? Hoe weet jy dit gaan werk? In other words, how do you know it's going to work? Let's go and look at some articles. Now this is from Vasquez's book, and guess what? He's basically summed up certain findings, but he's always used research articles. Viral infections are less severe if the body is in an optimal supplement state. They used several in this article at the bottom right. They used HIV positive men and women, and they gave them selenium, and guess what? The viral load, the number of viruses in their body dropped. Cool. So then we've got another one, zinc supplementation, 20 milligrams a day. I think it's very little. I would go to 50 to 80 milligrams, but anyway, we'll talk about it later. And it reduces respiratory infections, morbidity. Then there's another one, another trial. It lowers respiratory infections in infants just with zinc. Here's another article, and let's go at the top there. This is PubMed. Now PubMed is the biggest library of scientific articles in the world. It's kept by the US government, and whenever one wants some scientific articles, you go and look there. This came out 2013. It was a study done in Germany, I think. And guess what? Vitamin C is essential for antiviral and immune response. If you look here at the side, at the bottom right, red ginseng and vitamin C increase immune cell activity, decrease lung inflammation induced by whatever. vitamin C deficiency increases lung pathology of influenza. So they all tell us the same story. Here's another one. I went along and I typed in vitamin C effect on viral infection. I got 10,000 hits, 10,000 articles that deal with vitamin C and viral infection. So do you think that has been researched? You can bet it has been researched. So there must be answers. And you can just start. This is what came from the search. You can do it for yourself, and you can, if you look at the top here, vitamin C is an essential factor in the antiviral immune response. Correlation, okay. Intravenous vitamin C, supportive care, cancer, and so forth. So please, if you're bored, go and look at that, and I'm sure you will find it really, really revealing. Vitamin C, that's always been condemned, is a really important factor here. So what do other guys say? This is one person that is in China. He's an American trained doctor. He works in North America and in Mexico. And by the time the virus pandemic started, he was in Wuhan, in his home country in China. And he's been there ever since, and he's been working with many of the doctors that are right at the front of this whole thing. So at the bottom you've got his YouTube channel, and as today at 1 o'clock today on Independence Day, the link was still working. So please have a bash and see what he has to say. There are several videos, they're all really interesting, and I believe he's a really genuine person who wants to help. Andrew Saul. Now Andrew Saul, remember, he was a guy that was mentioned earlier on. He's got a whole website. He's one of the most knowledgeable persons on vitamin C and supplements, and you can see here he's got one video, coronavirus, vitamin C and censorship. I clicked on it. Somebody else told me it doesn't work, but it did work with me, and that gets you to it's the bottom site here at the bottom. The last link at the bottom is Andrew Saul. And now there's another one, second last. So please go and have a look. These are certain websites that I've pulled out that you can use. You will find a lot of really fascinating information. The third one, or the middle one, is in German. It's a Professor Dr. Spitz. For those of you who can understand German or speak German, it's a hive of information there, a really huge amount, and he's very, very easy to listen to, and he's a fantastic, knowledgeable guy. Good. So I've been sitting here for the last 30 minutes telling you all sorts of things. What I'm really trying to say is, when we're done with our independence celebration, we should really get stuck in and implement a fast and affordable supplement solution or option. So what would that be? Here's the formula. You take 3 grams of vitamin C a day, you take 10,000 units of vitamin D a day, magnesium 500 milligrams, zinc 80 milligrams per day, and selenium. And you use it for 2 months. Why only for 2 months? Because the dose is quite high. Number one, you don't need that high a dose for long, but for the time now while you possibly exposed to corona, this is a fantastic, simple, dis 'n regte boereplan. It works, it doesn't cost a lot. I'll explain to you just now, and you will be a huge amount better off than not taking anything like that. It'll be provided in powder form. You can obviously go to pharmacies and buy all these ingredients individually. It will be available in powder form. We've been working on this, and it will be available possibly next week, which would be the week up to the 27th, 28th. We really try and push it, and then you will be available to get it. So it'll be a small scoop, and you take it 3 times a day. It'll get you to 3.5 grams of powder, and you chuck it in normal tap water, not hot. because it destroys the vitamin C. And also please don't take any sugary drink with it, because vitamin C and sugar look just the same, and if you get it into your system, the sugar will be taken up and the vitamin C will be excreted. Let me repeat that. Don't use it with sugar because you will waste your vitamin C. Cool. So where will you get it? You can, as I said, you can mix it yourself. You buy it at anywhere, pharmacies all over the place. If they still have vitamins, many of them are sold out, but they will get them again, so don't worry. Then there is Novice Pharmacy, which is a compounding pharmacy, but they also make this. We call it Coromax, which is the mixture that is ready made. And then of course Coromax will also be available at my practice, and our practice number during office hours is there at the top. Now, how much will this thing cost? It'll cost you less than 500 Namibia dollars a month. So I believe this is a really, it couldn't be simpler. The question now that I'm anticipating is, can it really be this simple? Can this whole hype be this simple? Look, what we've discussed is actually not that simple. It's a whole strategy that partly has been implemented. You could say 80% has been implemented. But if you want to make sure about the last 20%, I think this is the information that you need, the information that I've given you just now, the last 20% to put you in an even better place. So please don't just take vitamins and stop washing your hands. Don't just take vitamins and go into big crowds. Just do whatever has been said already, what has been implemented, and then add those daily vitamins for yourself, your loved ones, and the people that you care for. I hope, and my sincere hope is that the government will look at that and will hopefully implement something similar or the same, it doesn't matter, but something has to be done, best because the mechanisms that are in place now are not good enough to, if we get a couple of infections, it'll go the South African way. And I've got our contact with South African healthcare practitioners. We've got certain WhatsApp groups, and I promise you the virus is really, it's like a felt fire. The first couple of flames you can step out with your boots. The next couple of flames you can hit out with a bag, and eventually when it gets going and there's a little bit of wind, you cannot do a thing about it anymore, and it's getting to that stage in South Africa, I believe. So whether they will catch it or not, I'm not sure, but please, let's just see when we're done with our party, let's get going and hopefully implement something. What's the good news? The good news is that all this drama will have an end. It's got a beginning and it's got an end. Nothing will last forever, so please relax. Trust in your own intuition, trust in your own abilities. Realize that you're in an amazing place, and that the people that have started in this pandemic are actually the ones that are nearly out of it as well. So this was about 2 days ago. China didn't have any new cases, and if they don't have any new cases for 2 weeks, they will basically resume normal daily life again, which is an amazing story, because once they've gone through it, they know so much more, they've learned so much more. And it's the old saying, don't go around your problems, navigate through them, and you will come out stronger and better. So to all my fellow Namibians, thank you for listening. Thank you for your time. You will be fine. And good luck. And if there are any questions, there are many resources in these videos, and there are also resources on the public media. But just remember, everything is not as good as you hope, and everything's not as bad as you fear. Thank you for your time. Have a great day. Bye.